Okay, so I don't have a biohazard bag, so I'm using a plastic bag and I'm pretending that this is the appropriate biohazard bag, and I formed a cuff around a receptacle. My wound is here and I have all my supplies. So I have provided my patient with privacy. I'm going to perform hand hygiene. Now I'm going to put on some clean gloves. And now I'm going to remove the old dressing by first pulling towards the wound. Pretty hard. Okay, and then my wound is aligned, so I'm going to pull parallel to the wound. Try not to pull. And then I'm going to take it off by putting the dressing inside. Now I'm going to perform hand hygiene again and open my sterile container. And I'm going to don my sterile gloves. Move this on a flat surface, and then I'm going to move this open, and with my non-dominant hand I'm going to pinch the bottom. Okay, and then I'm going to put my fingers in the cuff portion of this. Okay, and then I'm going to move that. So then everything in the kit is sterile, so I'm going to take the alcohol swab and I'm going to clean the wound and the peri-wound area, going outward. Okay, I'm going to dispose of that. And then I'm going to take my gauze and I'm going to completely dry the wound. Okay, and I'm disposing of everything in the biohazard bin. Now I'm going to take the sterile transparent dressing and I'm going to remove the paper backing, and I'm going to, without stretching it, first, before I put on the dressing, I will have inspected the wound for tissue type, color, drainage, and odor, and there's no odor or anything like that. There's nothing wrong with it. So now I will be putting on, and I would have done that before I took off the paper backing. Now I'm going to put on the transparent dressing without stretching it. There we go. I've put the whole thing on there. And I will have labeled the dressing, if indicated, per policy with everything that was needed. And now I'm going to remove my gloves by pinching and then going inside. And then I would perform hand hygiene. And now I will go document the procedure.